Hello, good morning everyone, and welcome to our ARC Talks webinar. Today we're going to focus on mental health matters and hear from speakers about how to look after your emotional well-being using a set of tools called the stress back approach. My name is Isabel Lusada, and I'm the CEO and founder of the Amyloidosis Research Consortium, or ARC, and I'll be today's moderator. So before we get started, I just wanted to give a bit of an update on the 28th of February is Rare Disease Day, and there are many events and ways to get involved this month to celebrate our community and raise awareness of rare disease conditions. In the section that's called the resource section and the website and resources on your screen, you'll see a link where you can learn about actions, events, and advocacy activities to support the fight against amyloidosis. We hope you'll join us, and as we've proven time and again, we're stronger when we work together. Now, I'm just going to give you a little bit about the background of ARC. And ARC was formalized as a patient-focused nonprofit in 2015 with the mission to accelerate the development of and access to new and innovative treatments for systemic amyloidosis and improve quality of life for patients. In all of the work we do, we partner very closely with patients, patient organizations, pharmaceutical companies, regulatory agencies, and researchers to drive our mission forwards and really deliver meaningful progress to patients and the families that we serve. We have four main areas of focus, and these are improving the speed and accuracy of diagnosis, increasing our understanding of the science of the diseases, accelerating regulatory approval for effective treatments, and also enhancing care and quality of life for patients. And these four themes inform and drive all of our work and keep us really focused on addressing the complex challenges while we work to support our community and close the gaps on unmet need. So I'm really delighted to introduce today's session. 26 years ago today, I underwent a stem cell transplant for AL amyloidosis. I was looked after by a remarkable team with a specialist focusing on each and every organ. But what was notable was how poorly supported I and my family were in dealing with the devastating diagnosis that literally turned our worlds upside down. Living with amyloidosis is extremely challenging and isolating. So I'm particularly excited to introduce today's webinar speaker. Just going to push the next slide. Kym Winter. And Kym is joining us actually from the UK, and she will be talking about tools and resources to practice when things start to feel like it's too much and when the community connections become even more critical. We're going to hold about 15 minutes or so at the end for questions, so do feel free to put your questions in the chat box as they arise throughout the webinar. Kym Winter is a psychotherapist with over 25 years experience. She's worked with the rare disease community since 2013. And in 2020 founded Rare Minds, which is a nonprofit organization based in the UK to raise awareness of and support mental health and well-being of those impacted by rare diseases and genetic conditions. In partnership with patient organizations, Rare Minds provides counseling services, workshops, and psychoeducational resources, as well as consultancy to organization leaders, industry, and healthcare professionals. Thank you so much for joining us today, Kym, and over to you.
Thank you very much, Isabel. I'm very relieved in that I was feeling I would need to practice my own approach just before starting this webinar, as we had a few tech issues. So it was a good reminder to me to manage my own stress in meeting all of you. But thank you so much for inviting me to come and talk to you about one of the strategies that we use with some of the patients we see in our work. And it's a tool that we find is quite helpful to bring to mind in all sorts of occasions, really, to help you manage your health and your well-being in an ongoing way. So I'll certainly try, and as I'm talking, to remember to give you some little practical tips and techniques and exercises as we go along. So just a little bit to recap on what Isabel was saying. So we started as an organisation in 2013 with just one tiny rare disease charity that approached us, recognising that, as Isabel was saying, one of the most stressful and difficult aspects of living with any rare condition is how it turns your life upside down and how you cope with the uncertainty and all the ups and downs of living with any rare condition. So amyloidosis is new to us, but I hope that some of the principles of looking after your health and well-being will have resonance for you in the amyloidosis community today. And just one of the things that I always want to say to normalise how difficult it can be living with a rare condition is just to bring your attention to a report that came out in 2018 in the UK, which was by Rare Disease UK, and it was on rare disease and mental health. And that identified that over 95% of their respondents felt worried or anxious, 93% felt stress, and 90% felt low. So from my perspective, this is a really unmet need that just needs to be integrated into living with a rare condition or disease in a very ordinary way. That how we look after our mental health is just as important as how we look after our physical health. So I'm going to introduce you to the idea of the stress bucket. And really what I want you to do when you're listening to me today is just sit back, enjoy, and listen to me talking. And maybe as I'm doing that, just notice and observe how you feel as I'm talking. If I'm going through and you're thinking, yeah, I know all this, or actually there's things I'd like to pay attention to, just notice what they are. So in terms of our stress bucket, we live with inside us a stress bucket that is really what we call our container for dealing with stuff. And over time, it fills up with the stuff of ordinary life. And when our stress buckets get too full of things like ordinary life events, such as things that we need to manage day to day. Oh, can I stop my slide there? Oh, let me just go back again. Okay, so just to start again here. So we get filled up by the ongoing demands of day-to-day life. That might be things like childcare, it might be jobs, it might be caring responsibilities. It's things like big life events. So we're talking there about things like bereavements or moving house. All of these things are stressful. It includes day-to-day and week-to-week things. What have I got to do today? What's demanding my time? What extra pressures do I have this week? And of course, inevitably now it includes global world events like COVID, or maybe worries about family in other places who may be dealing with weather events or things to do with climate change. So ordinary life is stressful and it fills up our buckets. And what we have to try and do is manage the level of our internal bucket so we don't overflow or become overwhelmed. So one of the things that's important to be aware of too, that managing the impact of a rare disease or condition takes a lot of emotional work. That includes managing the symptoms and side effects, difficult thoughts and feelings. Includes how your family and friends are managing your condition. How are they relating to it? Are they worried about it? Are they being supportive, or do they ignore it? It includes things like your healthcare team, how well you're getting along with them. And it includes things about fears for the future. How long is my disease going to be stable, or when might things change? So you can see that with your bucket over time, there is a dynamic relationship between your rare disease and your ordinary life. And one of the things that I really want you to take take away from this is noticing that your stress bucket is always going to be full to a certain extent with the things that you're managing as part of your rare disease. Is there a way, Isabel, we can slow down the animation, or is it just running as it is?
Yeah, I think it's just running as it is, I'm afraid.
Okay.
I don't think
That's fine. We'll work with that.
Forward each time you click.
Okay, let me just see. Okay, so here we can see. This is where we have a day where tech decides to work against us. Okay, let's just, maybe the universe is just telling us to recap this particular bit. So here is our bucket again of ordinary life, and we see it filling up with the stuff of ordinary life. And one of the things we have to be mindful of is we know in ourselves when we start to get full up, we say things like we feel overwhelmed or we feel tearful. So when we're living with a rare condition, we're also living with the uncertainties of that rare condition, the macro uncertainties of how it will impact us day to day, and the micro uncertainties of things like, will I get the consultant I wish to talk to, or will it be someone else I deal with? The difficult thoughts and feelings that go along with that, feeling anxious or feeling low, how family and friends are responding to your condition, and how your healthcare team is managing you. Do you feel well supported and well looked after or not? And that includes things about fears for the future. Can you talk to them? Can you talk to other people? How do you feel about those fears, and are they being well looked after and managed? So how much your room, your rare disease is taking up affects how much emotional space you have for other stresses and demands without being overwhelmed. And you'll know from your own lives that the demands that your rare disease places on you, how much amyloidosis impacts your daily life, your weekly life, your monthly life, will fluctuate, because this is one of the uncertainties of living with a rare condition. How much room it takes up in your bucket will vary quite a lot. So one of the things that we then have to pay attention to is how much energy and how much room have we got for life's ordinary demands. So there is a dynamic relationship between allowing our rare disease to be present, to be sort of sitting in the bottom of our bucket all the time. And one of the things that we often work hard with both patients and carers to think about is accepting that that rare disease is always there in the bottom of your bucket, if you like. Helps you to then make good choices about how you manage the rest of your life. And sometimes that means saying no to things that might be difficult, or putting things off, or accepting that that week something is not going to happen because your disease is playing up in some way, but it might feel more possible the next week or the next month. And the reverse is also true. When life is feeling particularly stressful and demanding, how is it impacting on your capacity to look after your health, your impact of your amyloidosis over time? So when life is more demanding and stressful, there's also needing to bear in mind, how is that going to impact on how well I can look after myself with my rare disease? Noticing things like, does my rare disease feel more difficult to look after this week, this month, this year, because I've taken too much on, too many other demands are being placed upon me? So I need to scale back a bit. I need to be thoughtful about this idea of how full is my bucket. And when you live with a rare disease, this is where you have to be, I think, sometimes quite tough, really, is the way to think about it. Make very clear, conscious choices about what you take on and what you don't take on. Sometimes when we work with people, the hardest thing to come to terms with is, how do you integrate this disease into your life? How do you let it be part of your life without taking it over? And that's a whole piece of emotional work in its own right, which I'm sure many of you are engaged with and are thinking about on a daily and weekly basis. So what I'm going to talk about is, how do you look after the rare disease portion of your bucket? How do you keep the levels in your bucket that are taken up by your rare disease as low as possible, to allow ordinary life to take up as much room as possible? And of course, the two interact in a dynamic relationship, but kind of keeping on it with your rare disease is going to be maximizing how well things go in the rest of your ordinary life. Okay, so I'm going to move on. So managing the impact of your rare disease or condition takes emotional work. You're managing uncertainty, macro and micro uncertainties. You're managing symptoms and side effects. You're managing difficult thoughts and feelings. You're managing your family and friends. And your healthcare team. So let's talk about uncertainty. So this is perhaps one of the most difficult. Oh, we seem to be stuck, not moving on here, Isabel. Do we know why?
No, I don't. I wonder if you, have you tried clicking on the slide? Does that help?
Yeah, that's where I'm clicking. Okay. You seem to be jumping around a bit on slides.
Yeah, it seems to be struggling with the animations for some reason.
Okay, so let's just move to here. Okay, so let's go on to, can we get on to slide 10? Okay. So how do we know when our bucket is filling up? Well, I can tell that my bucket is filling up now because of how I'm feeling with how the tech is not working. So one of the things we notice is how we think and how we feel. We might feel anxious, we might feel panicky. I'm feeling a bit hot and bothered. We might feel anxious, low, or overwhelmed. It affects us how we behave. We know our bucket is filling up by how we behave. Sometimes we do things like we use food to comfort ourselves when we're feeling overwhelmed or anxious and our bucket is filling up. I'm sure none of you here reach necessarily for the chocolate cupboard or the biscuits or, food that we necessarily know isn't particularly good of us, but is comforting to eat. Or sometimes we might go off food entirely. Sometimes we might get irritable with other people we care about, or sometimes we just withdraw. We find it hard to be around other people. So we know our bucket is filling up, perhaps by how we behave. Or our body shows us. Our body can show us our bucket is filling up by perhaps aches and pains, perhaps headaches or tummy aches. Or the symptoms that you have in your rare condition might feel harder to deal with. They might feel worse in themselves, or they might just feel more difficult to manage. So our body can show us when our bucket is filling up too. And we're not always very good at interpreting the messages that our mind or our body is telling us to try and say, okay, we have an alert here. You're getting a bit full up. What are you going to do about it? And how can we work together to help things feel less stressful? So you know your bucket is filling up by how you behave, by how you think or feel, and what your body shows you too. So one of the things with a rare condition, and I guess you might recognize this, is that we can often put down all sorts of things to being to do with the rare condition that aren't. We can forget sometimes that we have ordinary illnesses, ordinary difficulties. We tend to think, is this all down to the fact I live with amyloidosis or some other condition? So remembering that there's a general principle around self-care, which I'm sure you will all be familiar with, about eating well, getting enough rest, monitoring drug or alcohol use, taking your medication reliably, and exercising as best you can. And these are all really good general bucket self-care principles. So I'm going to sort of assume you know these as part of your everyday life. And I'm going to talk in a bit more detail about looking after your rare disease bucket portion. But one of the things that can be very helpful when we are feeling stressed or we feel that our buckets might start to be filling up is to recognize, as I was saying before, how does your bucket filling up show itself to you? And that's going to be very individual for all of you. Does it come out through your behavior? Does it come out through how you feel? Or does it come out in your body? And once you've recognized it, one of the most important things to do next is to start thinking. And this is where you discover agency in yourself again. Think to yourself, okay, I've recognized I'm struggling here. My bucket is filling up. How can I deal with this? And what do I need perhaps in the long term? Do I need to look at my schedule or how I'm spending my time to kind of ease some of the stress or pressure on myself? And what do I need right now? What do I need right this moment that would help? And sometimes that's as simple as taking a 5-minute pause, going to make a cup of tea, or saying to someone you love, have you got a couple of minutes to just give me a hug? Or sending a text to a friend and saying, how are you doing? Having a tricky day. Can we have a chat? Often when we're feeling particularly stressed, we can go inside ourselves a bit. We think we're the only ones feeling like that. But I always encourage you to reach out to someone. Consider talking to someone you trust. And more than anything else, be kind to yourself. When we're stressed, we can become very self-persecuting. We say things like, I shouldn't feel like this, or I should be doing better, or other people don't feel like this. And someone like me needs to come along and say sometimes, yes, we do. We all get stressed. We all get overwhelmed. And what's most helpful is that we can reach out to each other and support each other when we are feeling stressed and overwhelmed, rather than feeling that we have to deal with it alone. And of course, this is what is so important and marvelous about organisations like yourselves, that we don't have to deal with things alone. So one of the most challenging aspects, I think, personally, in dealing with a rare condition is how you manage uncertainty. And this is a theme we return to again and again and again. And it is one of the most challenging aspects because human beings across the board avoid this like the plague. We like to make things predictable. We like to know what is lying ahead. We like to feel prepared. So we have a drive towards certainty. And we have an anxiety that the future won't be okay unless we make it okay. This is why we have things like insurances. It's a bit like we're going, might not be okay, so I just need to put something in place just in case. You know, we're quite anxious as people. So uncertainty is one of the most challenging things. And one of the things I always say is when you are living with a rare condition, you will get really good at uncertainty by default because you will have to. So when we talk about uncertainty in rare diseases, we talk about the macro uncertainties, which are when you're living with the worry about how long is my disease going to stay stable for. Whether this disease is going to be something that this month, this year, I start to feel some decline or new symptoms, or there starts to be a problem with my medication, not dealing with things as well. The macro uncertainties of living with an ongoing rare disease is very challenging. So this is where we're back to the idea of the stress bucket. You're managing this anxiety around uncertainty all the time. Even if you don't know it, it's ticking away in the background and it can be tiring. It includes the micro uncertainties. So the day-to-day impacts of your condition. Is this going to be a day when I will have enough energy? Is this going to be a day when my bowel is playing up and I just need to be near the loo all the day? Is this going to be a day when I'm just going to feel under the weather and I'm not sure if something's going on? I'm not sure if I'm coming down with something or if this is my disease playing up in some way. It includes the uncertainties of, when you go to hospital or you go and see a healthcare professional, is it going to be someone you know? Is it going to be someone who understands your condition? Or is it going to be someone that you have to explain it all to again because they don't know that much either about amyloidosis or about the way in which amyloidosis manifests for you as a particular individual? So it includes a lot of uncertainties. One of the things that we have to do with living with a rare condition is learning to embrace not knowing. And this is not easy. And one of the ways we avoid not knowing is we tend to project into the future all our worst imaginings. So rather than being able to say to ourselves, I don't really know what lies ahead next week or next year, but right now I'm more or less okay. We tend to project into the future and make that not knowing void full of what ifs. Maybe this will happen. Maybe that will happen. I don't think I'll be able to deal with that. I don't think I'll be able to deal with this. Now, the reality is often those things that we most fear that lie ahead, we are better at dealing with than we imagine. If you think back to sort of other events that you've dealt with in your life, often it wasn't quite as bad as you feared. So one of the things we always say is remind yourself that you can deal with uncertainty, and we do so every day. When we go out and we drive in the car, we can't know for sure that we're going to arrive at the destination. Anything could go wrong. Our car could break down, there could be an accident, there could be a detour. We deal with uncertainty every day, but we don't notice it. We do deal with it. Making predictable what you can really help, particularly around stressful times like appointments or getting results. You may be worried about what your healthcare professional will say to you, or you may be worried about changes in your condition. So make predictable what you can, even down to really basic, ordinary things. I have an appointment today. I'm worried about what I'm going to be told. There's a lot of uncertainty there. But what I can make predictable is what time I leave, how I get there, what route I'm going to take, who I'm going to take with me. And after that appointment, looking after yourself by thinking, what am I going to do then? I'm going to go to this coffee shop. I'm going to have this cup of coffee. And this evening I'm going to watch a film. And then I'm going to go to bed at this time, because that's part of looking after myself. So when we're managing uncertainty, it's a lot about asking yourself, what can I address? What can I make predictable? And what can I not? And I know some of you may know the Serenity Prayer, and I often think it should be the rare disease prayer, that idea of, Lord, help me to change the things that I can, accept the things I cannot, and the wisdom to know the difference. And I always think that is absolutely at the heart of living with a rare disease or condition, knowing what you can change, knowing what you can't, and the wisdom to know the difference. And it's not easy. Managing symptoms and side effects, you will all know, is a very central aspect of living with your rare condition. And one of the things that when we work with patients and carers we talk about is the idea of re-befriending your body. When you live with any chronic illness or a rare disease, sometimes we hear a lot about the words of fighting, of getting into a sort of battle of sort of making your body submit to your will. It needs to do these things. And your body's going, I can't quite come up with the goods right now. It's doing its best. And the idea of re-befriending your body really means getting alongside your body again. It's almost like imagining yourself putting your arm around it and saying, I can see you're doing your best, body. I can see that you're doing your best. We're living with this condition called amyloidosis, but we're doing it together. We're doing the best that we can. And there's something about being able to use that aspect of your body to help you live with the condition that you both live with, which can take some of the heat out of feeling that you just have to carry on as if things aren't happening. There's 4 main symptoms that we often come up against when we're working with people with rare conditions. And I'm going to speak to them briefly because I know that they will impact all of you to varying degrees. But in relation to pain, I would really challenge you that if you are living with pain in any way, to really try and address it by talking to people who can help you, by not feeling that you just have to live with and accept a level of pain. I'm often surprised by how much we feel we have to just live with pain rather than trying to find ways of dealing with it. And one of the skills we often teach in the work we do is around mindfulness and mindfulness for pain, and the idea of leaning into pain rather than resisting it and trying to get away from it. And that can be a technique that if none of you have come across before, I would really encourage you to have a look at and learn more about, because learning to work with pain, to lean into pain, to manage pain, to kind of roll it round ourselves and work within it in a different way rather than just resisting it, can really help keep those levels of stress in your bucket low. Often pain causes us problems because we resist it. We just don't want it to be there, and that's very understandable. But learning how to lean into pain, learning how medication can help, but also how psychologically we can manage pain is very important. Fatigue is another one that comes up a lot for us, and I imagine is an issue for those of you living with amyloidosis. And one of the techniques we teach some of the time is spoon theory. And I'm wondering if any of you have heard of spoon theory. If not, I've given a link to it in the resources at the end. And I'd really encourage you to have a look. And again, it's the idea of accepting that there are going to be days that we are more tired than others. And really being able to gauge your energy levels. So spoon theory works on the basis that we all have a set level of energy. And we make conscious choices of saying, I have this sugar pot of energy. And thinking about your next day and saying, okay, so maybe getting up takes 1 spoon of energy. Getting myself out the door will take another spoon of energy. I want to go and see my children or my grandchildren. That'll take 4 spoons of energy. But if I have 20 spoons of energy in a day, how am I going to manage them? And it's about doing it in a very conscious way, rather than just sort of running full tilt at life, which is what we tend to want to do. We want to power on, we want to power through fatigue. But learning how to really make conscious choices about fatigue will help your energy levels, and it will help that aspect of your stress bucket stay low. The other thing that comes up a lot for us is what we call the smells and tells of living with a rare condition. And that's things around worrying about, if you have problems with your bowel, or you're sweating, or you have flushing, worrying about what other people will make of it, and fearing whether other people will notice, or whether you will feel embarrassed, or whether you will feel ashamed of something that happens. And one of the main things I want to say about that is often people are much kinder than we fear. And if you fear or you know that something is likely to happen in a social setting or in a workplace, finding people that you can trust and say, look, I am managing an aspect of my health which impacts me in this particular way. I may flush, or I may have a difficulty with wind. I need to let you know that. And it's difficult for me to manage, but I wanted to be upfront about it. And that can be a really difficult conversation to have. But in everyone that we've supported to have those sorts of conversations, what we've been struck by is the kindness of the responses from the people that they've spoken to. So it may be that if you're in that situation and in some way it's inhibiting you going out and about or going to family events or social events, maybe think about talking to someone and how they could help you with navigating the fear of being shamed, really, which we all have around smelling or being caught short, not being able to get to the loo. And these are very, very early fears we all have. It often goes right the way back to when we were children and being told off or being made to feel bad for not being able to control our body in some way. So they're very understandable fears. And what I'm encouraging you to do is perhaps get an ally who can help you deal with that in certain situations. And anxiety. Anxiety, I think, goes along with living with a rare condition too. And it's a level in your stress bucket that will go up and down. Some days you will feel sort of okay about it. It's all right. I've got this rare disease thing nailed. It's not bothering me so much. It's more off to one side. It's more in the distance. And there are other times when it will be much more kind of in front of your face and it will feel much more preoccupying. Your worries about your condition, about your future. So learning to manage anxiety is a really key aspect of living with a rare condition. And I'm actually going to make you do something now, which I can't see any of you on my screen, apart from Isabel and one other person. So I'm going to look at the two of you and hope that you do it. So wherever you are, I just want you to put your feet firmly on the ground. And this is an exercise I want you to remember and do when you're feeling worried. Just put your feet firmly on the ground. Now, however much breath you are able to take in, I want you gently to take a deep breath in through your nose and out through your mouth. So in and out. And we're going to do it again, but I want to do it on the count of 4. So in your head, breathe in to 4 and then out to 4. And go in. And into 4. And out. Now, what I'm hoping you're noticing is that even by doing just that very simple exercise, how much tension and anxiety we carry in our bodies without even really noticing. I found it helpful to do at this point in my webinar, but it's an exercise I want you to take away with you. So we often call that square breathing. The idea is that you move up the side of a square, breathing in. You hold your breath for 4. You breathe out for 4. You pause for 4. Breathe in for 4. Pause. Breathe out for 4. There's lots of little videos online that I can encourage you towards called square breathing. And it's a really good, basic, simple relaxation exercise if you're feeling anxious or worried. Bringing our attention to our body in that way helps our mind get the hang of the fact that it's probably safer than it thinks it is at right that particular moment. So I'm going to speak now to difficult thoughts and feelings, and I'm going to run through these fairly swiftly. But what I want you to do as I'm running through them is to notice the ones that you think, yeah, I felt that feeling, or I don't feel that feeling so much, but my partner's really good at doing that feeling. I think they do that one. Or maybe a friend or someone else in your family, but often it's a partner. Sometimes we don't like feeling certain feelings, so we sort of outsource them to the person we live with. I'm really chilled, but my partner gets really irritable. Yeah? Often the sort of the super feelings that we have in our lives, we parcel out to each other in a certain way. So grief. Grief is something that when you're living with a rare disease or condition is not just the grief of how things might have been, but it's often the grief about an imagined future. The grief that, what would my future look like without this condition? And the worry about what might lie ahead. So getting familiar with grief and changes in your body, things that maybe felt easier to do at one point but aren't so easy now, that's all grief. Despair. Sometimes despair can visit us with a rare condition. I don't want it to be like this. I don't want to be living with this. How am I going to cope in the future? Things aren't feeling stable. Things aren't feeling okay. We can feel despairing. Envy. Envy is a difficult one to acknowledge. Envy when we look at other people, maybe friends or family members, and they're not living with the impact of amyloidosis. Life is freer, life is easier in certain ways. That painful feeling of looking and wishing things were different, that's envy. We don't always like feeling envy, but naming it can be helpful. Disappointment, perhaps when treatments don't go as well as hoped, or appointments don't go as planned, or events or things we look forward to have to be put off because of the impact of the condition. And just the general disappointment of amyloidosis being part of your life. I imagine no one of you signed up for this when you were younger. I'm going to be a fireman, and I'm going to be a ballet dancer, and I'm going to be an astronaut, and I'm going to have amyloidosis. It doesn't work like that. It wasn't part of the bigger picture. So disappointment. Anger. Anger is sometimes a very healthy, normal, and appropriate feeling to have when your body is not working as well as it should be, or when you are coming up against systems or processes that do not facilitate living with a rare condition. I know that many of you will have got your diagnosis by very circuitous routes and by coming up perhaps against many healthcare professionals who may not have understood you, or at times had your symptoms dismissed or misunderstood. So feeling angry about aspects like that, but also angry and frustrated that it's not always as straightforward to do things as other people do without a rare condition. Resentment. Sometimes we just resent living with a rare condition. Shame, particularly as I was talking earlier about when our bodies behave in ways that are perhaps embarrassing, or shame, I think, is also very linked to the hard time that we can give ourselves that we are not coping better. And if there's one thing that I would ask you to take away from this webinar, if this is something you struggle with, it's stop giving yourself a hard time and feeling that other people are dealing with it better than you, that you should be dealing with it better, or you should be dealing with it differently. Mostly in life, we are doing the best that we can. And if we could do something differently, we would. So try and ditch the shame is one of my takeaways from this webinar. Anxiety, I've already touched on. Fear. Fears about the future. Fears about things progressing. Fears about dying. How will I cope if I'm really unwell? Fears for people that we love. Will they continue to love me? Will they continue to support me if things get really bad? And sorrow. I think when you live with a rare condition, there is a level of sorrow that is always a kind of residual layer in the bottom of your bucket. The sadness that this is something that is just part of life. And that I'm certainly not denying that sometimes when you live with a rare condition, there is a bittersweetness to life. The sky can feel bluer at certain times because you know how tough life can be. But there is nevertheless an underlying level of sorrow that I think comes along with a rare condition. And loneliness. Any disease that we live with is lonely. A rare disease is doubly lonely. Some of you may live near or close to other people with amyloidosis, but for others of you, I guess most of your interactions will be online or occasional meetups in person. So, you know, that loneliness that goes along with describing you have amyloidosis, it's not the same. People will tend, I imagine, to lean out. You know, if you say to someone, you've probably seen it with your friends, if someone says, you know, I've just been diagnosed with breast cancer, so people will lean in, people will engage, people will say, oh my goodness, everyone's heard of breast cancer, everyone understands. You say to people, oh, I have this rare condition, amyloidosis, people go, oh, okay. They're not sure how to respond, and they lean out a bit, and that can be painful and sometimes angry making too. So how do we deal with difficult feelings? Well, there is no easy one way, but these are some of my tips. Notice and try to name the difficult feelings. One of the worst things we can do is pretend that they're not happening. This is why we sort of have to lean into them. We sort of have to go, what is it I'm actually feeling here? Yeah, I'm feeling anxious, or I'm feeling worried, or I'm feeling angry. Okay. Feelings have no moral value attached to them. They just are. What we do with them has moral value attached. If I'm feeling angry, it's not a good idea if I go into my living room and kick my cat. That's not okay. But feeling angry is okay. Feeling angry is just a feeling. Decide what helps. This is back to when I said before, what helps right now? What do I need right now to help this feeling be more bearable? Do I need to talk to someone? Do I need to just sit with it? Like when we did the little square breathing exercise, can I just sit with it? Does it help to walk or exercise? Can I get the feeling out by maybe drawing or painting or writing it down, writing it out? Some of you I know might listen to music, either really loud music, music that gets you more into the feeling, or music that distracts you from the feeling. So listening to music can be helpful. And recognizing that all feelings pass in their own time. The happy feelings, the good feelings, the feelings we feel good about, we want to hold on to, and we don't want to let them pass. But they pass too. Every feeling will pass in time, and every feeling ebbs and flows over time. So notice what helps when a feeling is visiting, and it will only visit. And notice who helps, and also how you can help yourself. So the other area in your bucket to keep an eye on is your relationships with your friends and your family and colleagues, because these can both decrease stress and they can increase stress in our buckets. So this is where we have to be kind of sharp. We have to be kind of like on it. Who are those friends and family members that I can go to and I know help me feel better when I'm struggling? Who are those family members that I know I can talk to if I'm feeling low? And who are those friends or family members that I know I really can't talk to because they won't help? They will say the wrong thing, or they will rub me up the wrong way. And knowing who is good for what is a really key part of living with a rare condition. You might know that your Aunt Polly is fantastic for bringing round a meal. If you're having a struggle with energy or fatigue, or you've been out for a long time, having a meal there on the table when you get back would be great. So Aunt Polly is really good for bringing round meals. If you try and talk to Aunt Polly about how you're feeling, she'll get flustered, she'll change the subject, and she'll start to talk about the weather. However, your friend Michaela may be the complete opposite. So sometimes doing a little bit of a sort of a friends, family and colleague audit about who is good for what is really helpful, because one of the most painful things is when we keep trying to return to people for something they can't provide us with. And often this is true of family members. I was talking to someone recently, and she was saying one of the most painful things about living with her rare condition is that she would like to be able to share the impact of it with her sister. And her sister is unable to engage with what it means for her. And it is a constant source of disappointment and grief for her that she cannot talk to her sister. And one of the things we talked about was maybe it's important to accept that and to enjoy her relationship with her sister for what it can be, and to not keep focusing on what it can't be. And this is where it's about bearing disappointments. Accepting the disappointment can sometimes allow other things to take place. The other thing I always say is find your people. Who are the people who support you? Who are the people that understand and get you? And that's why I'm always so pleased to come and talk at events like this, because all of you are here because to some degree, this organisation helps you find your people. And I think Donna is going to talk a little bit about the support groups and the online groups that are very much part of looking after that stress bucket portion of that rare disease portion of your stress bucket. Your relationship with your healthcare or your professional team is, again, really key in terms of how well you feel you are managing your stress and living with a rare condition. So if you feel safe and you feel secure with your team, your stress bucket level there is going to be understandably much lower than if you're feeling a bit unsafe or not quite secure or not quite settled with a healthcare professional team. So I'd really encourage you not to kind of settle for what feels not okay. You need to at least have a degree of confidence in those who are working with you and looking after you on a week-to-week, year-to-year basis. And if it doesn't feel okay, I'd encourage you to talk to maybe the people at ARC or other people who can help you find your way to the right people to support you. The other thing I would say with a rare disease or condition is it's a bit like getting married. You will end up in the main with this healthcare professional team for a very long time. And just as marriages and relationships need to be worked on, your relationship with your healthcare or your professional team will probably need to be worked on. They will sometimes run you up the wrong way or irritate you or get things wrong. And in my experience, the most useful thing to do is to try and train them up as to what works for you. I was talking to two different people just recently, and one of them was saying to me, the most annoying thing about my doctor when I see him is that he just tries to give me so much information. And you know what? I don't want to know. I just want him to tell me the basics and I can go and get on with my life. And if there's something I need to know, he can tell me, but I don't need to know all the other stuff. And I said to him, do you think he understands that? And he said, well, it's obvious, isn't it? And I went, probably not to him. Maybe that's something you could let him know. He might find that helpful. And then I was struck by very soon afterwards, I had another conversation with someone else I was seeing. And she was saying, I get so frustrated with my consultant. It's like getting blood out of a stone. I always feel like he's holding something back from me. I always feel like there's something he's not saying. And I just don't know how to deal with it. I said, that's really interesting. You'd like to know more from him than he's actually revealing to you. Have you said that to him? And again, she said, well, could I say that? And I said, yes, this is part of training up your healthcare team to look after you in the way you need. And that's not going to be obvious to them. In the same way that when we get into conflicts in our relationships, in a partnership or with our partners, we often think that something is obvious and it isn't. And then our partner says to us, well, why didn't you say that? I'm not a mind reader. And it's the same with your healthcare professionals. They're not mind readers. And the other takeaway I'd say from this is always remember your team is there to look after you. It's not the other way around. Sometimes, I was talking to someone else recently and she was saying, my consultant is so pleased with how I'm doing. I feel really bad about letting him know that actually I'm really struggling. And she'd had an appointment where she just hadn't felt she'd really got across how much something was really troubling her in terms of a particular symptom she was having, because her consultant just kept saying, you're doing really well, you're doing really well. And she said, I know I'm doing really well, but he wasn't getting it. There's a way in which I'm really bothered by this and he's not getting hold of it. And I don't want to disappoint him, but I need him to get it. So remember that your team is there to look after you, not the other way around. So facing fears about the future. This is another really challenging aspect of living with a rare condition. And this goes back to where I was saying earlier. We tend to fill the future with all our worst fears. We are terribly bad about allowing ourselves to not know. So we sort of see a bit of a void ahead and we go, oh, there's not much in that. I know what I'll do. I'll stuff all these thoughts into it and fill it up a bit. What if this happens? What if that happens? This might happen. What might that happen? And all I can encourage you to do is notice when you're doing that, because usually dealing with what is just in front of us is enough for now. If we start trying to deal with what we imagine might happen in the future, it's too much. We're filling up our stress bucket unnecessarily, because the reality is we don't know what will happen in the future. We don't know how we will deal with situations in reality. We don't know how bad they will be. We don't know how we will actually feel until we get there. So having dress rehearsals for this stuff is very, very understandable. It's sort of what we do as human beings. But it's a way in which our brains are not particularly helpful for us. We're sort of reverting back to, our very earliest existences, where we're sort of out there on the savannah and we're trying to work out where the lion is. And we're sort of scanning the horizon. Where's the lion? Where's it going to jump out at me? And the reality is we can't always know where the lion is going to jump out from. There might be a lion ahead, but actually we're usually better at dealing with the lions than we fear. It may not necessarily even be a huge, great, beardy lion. Quite often the things that we fear ahead might actually turn out to be little lion cubs. So there's something about being able to acknowledge our fears, but not investing in them. Going up to them and eyeballing them, saying, yes, I can see that I'm worried about you. I am frightened about this. But right now, right here, I'm okay. So I'm sure there's all sorts of fears and worries you all have, as I have, about our futures. But if we go back to our little square breathing exercise, right now, we've just got our feet on the ground. We're talking to each other in this webinar. It might be raining outside, or it might be sunny. There might be people coming in and out of our house, or there might not. But right now, right this minute, we're safe and we're okay. So if you have a recurring fear about your future, sometimes it can really help to say, is there something I can do about this? Is there something I can know? Or is this something I just cannot know? Now, things that you might know and you might want to put in place if you're worried about your future might be things like, I'm really worried about what might happen to a particular family member, or something if I'm not here, or if I can't help support them. That's something you can do something about. Think with someone you trust. If that was the situation, what am I going to do about it? So you walk up to it, you deal with it, and then you put it down. But the things we cannot know, those are the ones we just have to eyeball and go, I know you. I know you. I'm just going to sit with the not knowing. I'm not going to fill this future ahead of me with fears where I cannot know how I am going to respond or how others are going to respond, because it takes energy I need for just dealing with what's in front of me right now. So what I'm going to do right now is deal with the next thing I need to deal with. Yeah? Okay. I hope that's been helpful. I have talked a great deal, and thank you for bearing with me with all our tech glitches at the start. It's been a week of complete tech glitches from my perspective, so thank you for bearing with me. And I've just put some resources here, just ones that we like as a team in Rare Minds and we sometimes suggest to people to use. And A couple of them, you might know. There's some smartphone and tablet apps called Buddhify and Headspace and Calm. And they give you lots of other exercises like the ones I've just done about kind of grounding and breathing. And something that you may or may not come across before, and I'm very happy to talk to you more about, is mindfulness, which is really good for dealing with pain and anxiety and fatigue. And then I've put a link here to spoon theory that I was talking about before. And just a couple of books that actually patients have recommended to us and said we found them really helpful. And if you want to pass them on as a resource, here they are. So thank you very much for listening to me and bearing with me and our glitches at the start. And I hope there's some things out of this that you can take away and will be helpful to you going forward. I'm very happy to answer questions. I don't know whether that's now or at another point, but please feel free to ask things in the chat, or perhaps Isabel, you could direct me to some too.
Excellent. Thank you so much, Kym. And we will share with everyone these resources that are listed afterwards. So don't worry if you're not able to write them down. We will send a note out afterwards. I think you touched on so many things that I certainly experienced, and the loneliness, grief, anger, and despair. And I love the analogy of a marriage with your healthcare professional, because I think absolutely it's critical that you build that relationship to serve you. And everybody has different needs. And so helping physicians understand what your needs are key. Mm-hmm. And I know we're sort of running tight on time. I'm going to introduce Dina, and then we'll hopefully have time for a question or two. Dina Heath is a remarkable force, and I'm delighted to welcome her today. She serves on the board of directors for ARC, and she also runs the fabulous Northern California Amyloidosis Support Group. And Dina, I'd love you to take a few moments and talk about some of the resources and community support that's available.
My turn, Isabel?
Yes.
Okay. Thanks for inviting me. I'm always happy to talk about support groups and the benefits that they bring to patients, families, and caregivers. Just a quick note about me. I was a caregiver for my husband with AL amyloidosis for 7 years and have been working in amyloidosis since 2004 when I started the first support group in Northern California. We're near the Stanford and UCSF amyloidosis treatment centers. And like Isabel said, I also am a board member at ARC, and I do projects for Isabel and the folks at ARC. So I'd just like to real quick give you a list of things about why support groups really benefit patients and caregivers. First of all, you have an opportunity for meeting and befriending other people with the same rare disease and similar disease-related experiences. You have an opportunity for learning about your disease and related treatments, treatment centers, and medical experts in your area or elsewhere if you need to travel. An opportunity for learning about the varied but very common medical and personal challenges faced by amyloidosis patients and how to handle and work with them. It's one of the things that Kym covered there. Having a safe place to speak openly about your disease, your concerns, and your feelings. Giving and receiving emotional support in a safe place. Learning coping skills related to being an amyloidosis patient, another one of the things that Kym was talking about so well. It's a good place to feel empowered and hopeful as you interact with other patients living with their treatments, their organ transplants, and various changing life plans. It's an opportunity to connect with patients who are surviving and thriving far longer than what Dr. Google told you when you Googled your disease. It's access to medical experts. We have in support groups, not just mine, but support groups all over the world, bring in doctors and researchers, social workers, and other advocates who present and participate in your support group meetings and who are available for questions and answers for group participants. Access to patient advocates representing pharmaceutical companies with treatments and clinical trials. That's been a particular interest in the group that I have, because patients will actually corner these for volunteers and say, how do I get in your trial? How do I get what you have to offer? How do I find your drugs? How do I afford your drugs? So we love to have them come, as well as all the others. It'll also give you a chance to learn about advocating to improve healthcare for amyloidosis disease patients in various forums and other opportunities, such as panel discussions and interviews. I know the folks at ARC get lots of requests for patients to come and talk about their personal experiences and share just living with amyloidosis with big audiences. And last, I'd like to say, since you're all here on this webinar, you already know that the ARC has a wealth of support resources, which you can find on their page labeled Finding Support, where you can leave a message and connect with personal support, along with many other wonderful resources covering many topics related to amyloidosis. And you'll also find support groups in amyloidosis treatment centers and other amyloidosis organizations, and on Facebook, just by Googling the word amyloidosis. And Isabel, that's what I'd like to say about support group meetings. I would encourage every patient and caregivers to participate in them if they are available. Of course, with COVID, we haven't been doing that for the last couple of years, and I can personally say that I miss my support group more than just about anything. Webinars are great, but they're not the same as being face-to-face with a group of people suffering from the same thing. So I hand it back to you, Isabel.
Thank you so much, Dina. And again, we'll share the link to find out where there are different support groups that you can possibly join. And I do think there is so much to learn from other patients and their experience, as well as how important it is to be informed about your disease. It really can help you manage, I think, some of the stress. And Kym, I'd love to hear a little bit your thoughts. Like, there are wonderful ideas that you came up with and suggested. And I know we all tend to an era of over-cramming our lives with everything. How do you kind of start making space to do this?
Well, I think what I would say is, remember I said at the start, pay attention to what caught your interest as I was talking. And usually what catches our interest is because we know there is something in it that we might need to pay attention to for ourselves. So I think that would be the first thing. What caught your eye or what caught your ear as I was talking? And maybe, go away from this presentation and think about it a bit more. Why has it caught my attention? Why has it caught my interest? But the other phrase, I often think is, and I use this for myself, is I just say to myself, how full is my bucket? How full is my bucket today? How full is my bucket this week? And to try and make adjustments in my life day to day, week to week, to look after myself and my stress levels. Now, that's not always easy, because sometimes it means either disappointing other people or disappointing ourselves. But often we run into trouble when we know our stress buckets are getting a bit full, but we try and power on anyway. And then we overflow. I always think it's a bit like, we sometimes we overflow literally through our eyes, we leak, our tears come out, our bucket's too full. So I often have a lot of faith that we often know when our buckets are quite full, and the challenge is how to look after ourselves and give ourselves permission to do that, and that's the key, giving permission to self-care, really.
Excellent. And I did, I very much like your description about the spoons, because I do think fatigue is a huge issue for patients, and how to manage that and preserve your resources. And likewise, how helpful it was to hear about pain. I think it's something many patients don't get support for, and we feel we have to just bear it, and really addressing that. So that was very helpful to hear. So,
and I think they are both, just to add to that as well, I think they are both areas that need much more attention in living with amyloidosis, but other rare conditions. And, you know, if you wanted me to come back and talk about either of those again, I would be more than happy to. So thank you for drawing attention to them too.
Excellent. Well, we will call on you. So thank you both very much for joining us today. This was an excellent webinar. We've had some wonderful comments. People have really found this very useful. We will be sharing the webinar for those who came in late or missed it in our resources online on the ARC website. Any of the resources that were discussed today we'll also be sharing. So thank you, Kym and Dina, for joining us today.
Thank you very much.